Doctor, I'm experiencing some issues that are worrying me. I've been having trouble getting and maintaining an erection lately. I'm concerned it might be erectile dysfunction.
I understand your concern. Erectile dysfunction is a common condition, so you're not alone. To help me better understand your situation, can you tell me when you first noticed these symptoms?
It started a few months ago. I used to have no problem with erections, but recently it's been difficult to achieve and sustain one during sexual activity.
I see. Have you noticed any other changes in your health or lifestyle that might be contributing factors?
Well, I've been feeling quite stressed at work lately, and I've gained some weight over the past year. I also have a family history of diabetes, although I haven't been diagnosed with it myself.
Stress, weight gain, and a family history of diabetes can all contribute to erectile dysfunction. It's important to address both the physical and psychological aspects. I'll need to ask you a few more questions to get a clearer picture. Are you experiencing any pain during intercourse?
No, there's no pain. It's just that my erections don't last long enough or aren't firm enough to engage in sexual activity.
Thank you for the information. It helps me narrow down the possible causes. Based on your symptoms and risk factors, I suggest we explore both physical and psychological factors contributing to your condition. We may need to run some tests.
That sounds reasonable. I want to get to the bottom of this and find a solution. What kind of tests will be involved?
We'll start with a thorough physical examination, including checking your blood pressure, examining your genital area, and assessing your overall health. Additionally, we may order blood tests to check your hormone levels, cholesterol, and blood sugar. Depending on the results, we might consider further specialized tests.
I appreciate your thorough approach, Doctor. I'm willing to make the necessary changes and explore all options to resolve this issue.
That's great to hear. Rest assured, we'll work together to find the best solution for you. Remember, erectile dysfunction is a common condition and there are effective treatments available. We'll get to the bottom of this and find a suitable treatment plan to improve your sexual health.
Thank you, Doctor. Now I'm relieved to know that I'm not alone in this and that there's hope for improvement. I trust your expertise and guidance.
You're welcome. It's my pleasure to help. Almost every third male patient of mine asks me about fixing his erectile dysfunction. Can we reverse erectile dysfunction? Or is there any natural treatment without any surgery or supplements? So in today's video, I'm going to share 10 natural treatments for fixing your erectile dysfunction. If you're visiting any doctor, keep visiting him, and if you're not, then you should seek a professional healthcare. But add these natural treatments in your life that I'm going to share, and you will be able to reverse erectile dysfunction in a few months. So, let's get to the video. These natural treatment is not just for those who are suffering from erectile dysfunction, but it is also helpful for those who are good at erections as well, because erectile dysfunction is very common in this world. Almost 1/3 of men have erectile dysfunction, and all I want is that none of you should fall amongst those 1/3 men, and even if you are, you should get cured as soon as possible. That's all I want. Please take a moment to subscribe this channel, you won't regret it. Hit the bell icon as well in case you don't miss any of our upcoming videos. Erectile dysfunction, also known as impotence, refers to the inability to achieve or maintain an erection sufficient for satisfactory sexual activity. A study published in 2020 shows that 1/3 of men have erectile dysfunction. This study found that around 52% of men experience some form of ED, and that total ED increases from about 5 to 15% between ages 40 and 70. Though the risk of ED increases with age, it's still possible for young men to experience ED. Why this happens? Well, of course age factor plays the role. Unfortunately, by the time the average man reaches 40, it's very likely that they will go on to experience erectile dysfunction. Let's quickly go through some common causes which are responsible for erectile dysfunction. These causes can be classified into two factors. First one is physical, and the second one is psychological. Let's talk about physical factors first. High blood sugar levels can damage blood vessels and nerves, affecting the blood flow and nerve function necessary for an erection. Low testosterone levels, thyroid problems, and other hormonal disorders can contribute to erectile dysfunction. Conditions such as atherosclerosis, hardening of the arteries, high blood pressure, and heart disease can restrict blood flow to the penis, making it difficult to achieve or maintain an erection. Conditions like multiple sclerosis, Parkinson's disease, and stroke can disrupt the communication between the brain and the penis, leading to erectile problems. Certain medications like antidepressants, antihistamines, blood pressure medications, and chemotherapy drugs can have erectile dysfunction as a side effect. Additionally, treatments for prostate cancer, such as surgery or radiation therapy, can also cause temporary or permanent erectile dysfunction. Being overweight or obese can increase the risk of developing cardiovascular disease and diabetes, both of which can contribute to erectile dysfunction. Now let's quickly review some psychological causes. Stress and anxiety, depression, low self-esteem, negative body image, or low self-confidence can impact sexual performance and contribute to erectile dysfunction. Relationship problems, difficulties within a relationship, unresolved conflicts, or lack of emotional intimacy can affect sexual functioning. Performance anxiety, fear or pressure to perform sexually, can create anxiety and leads to erectile dysfunction. So, these were some common causes which can lead to erectile dysfunction. Now, how can we reverse it? Can we do it naturally? Well, yes, absolutely. It can be treated through medicines prescribed by your doctor. Plus, it can be reversed through various exercises and surgery. But, add these 10 natural remedies in your routine and fix your ED naturally. Number 1 on the list is diet. A study published in 2020 clearly shows that if you take Mediterranean diet, then you have low risks of erectile dysfunction, plus you remain more sexually active. So, what is a Mediterranean diet? It includes legumes, nuts, fruits, vegetables, and fish. In fact, it has been seen that the foods rich in omega-3 fatty acids and vitamin E are best to reverse erectile dysfunction. There is also another important study which shows that people who consume flavonoids, which are extracted from natural plants, usually found in coffee, tea, and citrus fruits, etc., and carotenoids, usually found in carrots, spinach, kale, watermelon, orange bell peppers, etc., have very low risks of having erectile dysfunction. So diet is very important for your overall health and also for maintaining your sexual function. Consuming a diet that is high in fat and low in nutrients can contribute to erythrocytosis. That means having a high concentration of red blood cells in your blood. This makes the blood thicker and less able to travel through blood vessels and organs, which sometimes reduces the flow of blood through penile veins and results in erectile dysfunction. Second best remedy is exercise. There is a research paper published in 2018, which shows that physical activity has proved to be a protective factor against erectile dysfunction, and it has been shown to improve erectile dysfunction for men affected by vascular ED. Physical activity includes aerobics, swimming, running, cycling, etc. Because workout increases the blood flow and opens the blood vessels, plus it reduces your stress. And when stress gets low, testosterone levels increases, and it overall affects penile veins and improves your erectile dysfunction. The important question is, for how long do you have to work out? You have to work out for 40 minutes, at least 4 times in a week, and if you do it regularly for 6 months, you will see the positive results in fixing your ED. You may want to come back after 6 months and say thanks in the comments section. The next on the list is sleep. The amount of sleep you get each day is important. Good sleep quality is also essential. Recommended hours of sleep per day is about 7 to 8 hours. There is a study published in 2017. It has been shown that those who work in night shifts have more likely to have erectile dysfunction because their hormonal pattern gets changed. Plus, poor sleep quality leads to low testosterone and increases diabetes and blood pressure as well. These 3 factors leads to erectile dysfunction. So, make sure to get a good sleep of at least 7 hours a day. The next naturally remedy is weight loss. Weight loss is very important. The individuals who are obese, they usually suffer from diabetes, blood pressure, and have low testosterone levels, are most likely to have erectile dysfunction. In fact, there is a study which shows that the gastric bypass and other weight loss surgeries done on individuals with obesity, after surgery they became thin and they saw an improvement in erectile dysfunction. So, if you're overweight and having an ED, focus on losing weight first. Psychological counseling. If psychological factors contribute to ED, counseling or therapy may be beneficial. It can help address emotional issues, reduce performance anxiety, and improve overall sexual confidence. Because sex is directly connected to your emotions. If you have any kind of stress, you may not want to have sex for sure. And of course, you don't get erection as well. So, psychotherapy is also important. In a recent research done in 2021 says, psychological interventions like cognitive therapy has a great effect on erectile dysfunction. Sex therapy and couple counseling. Well, sex is an activity which cannot be done solo. It needs a partner. So, in this partner game, therapy and counseling plays a very positive role towards your sex life and erections as well. Stress reduction. Stress is the major contributor towards erectile dysfunction. A study published in 2019 states that prevalence and predictors of erectile dysfunction in adult male is mostly stress. It states that stress is directly proportional to erectile dysfunction. Alcohol reduction. Well, many people think that after intaking alcohol you experience a better sex. I'll sum up this factor in just one line. Alcohol increases the desire but decreases the performance. Alcohol is also responsible for decreasing your testosterone levels. The next one is smoking. Reduce smoking as much as you can, because it blocks the veins and results in low blood flow. Smoking damages vessels as well. According to a research, the main physiological mechanism that appears to be affected includes the nitric oxide signal transduction pathway. It lowers the production of nitric oxide, which is essential for erections. I have made a video on boosting nitric oxide naturally. If you have not seen it yet, that is a must-watch. Go check that out, I'll provide the link below. The last one is vitamin B3, also known as niacin, and is considered to be the good weapon against ED. Vitamin B3 helps convert the carbohydrates, fats, and proteins we consume into usable energy. It plays a crucial role in the production of adenosine triphosphate, the molecule that provides energy to our cells, and hence helps in fixing erectile dysfunction. Remember, it's always best to maintain a balanced diet that includes a variety of nutrient-rich foods to meet your nutritional needs. So that's it for the video. I suggest you to add these lifestyle changes to your routine along with a proper treatment. And if you follow these natural remedies, I'm sure that day is not too far when you will be free from erectile dysfunction. If you have enjoyed the video, make sure to like and subscribe, because it motivates us to make more interesting and educational content for you people. Because your health is our first priority. Share it with your friends and family. Have a good day.